Jubbs cell rejuvenation, correcting metabolic neuropathy, fungal infection, and celiac in human disease by Dr. David Jubb, PhD, 2009. Cerebral blood flow, zygomycetes, fungus, neurotransmission, and celiac. Colloidal biology and the new theory of blood formation, see Jubbs cell rejuvenation, and dark and bright field microscopy forwards a view that on an anti-mold program, metabolic neuropathic condition clinically and empirically is seen to be cleared up. Construct validity of such is outlined herein that has as its basis a clearing away of all dysbiotic life colloid, spore, bacteria, mold, fungus, and yeast by applying Jubbs cell rejuvenation. Infectious disease and malabsorption of nutrient by zygomycetes and celiac has risen significantly in the modern world to create immunosuppression and metabolic neuropathy by hypoxic acidic microniche, where a bioterrain of fermentive cell and dysbiotic life colloid. Mycotoxin is a potent vasoconstrictor, creating metabolic neuropathic hypoperfusion, decreased, and hyperperfusion, increased, blood flow through various brain and body region. Hypoperfusion, low blood flow, is shown in temporal and in parietal lobe of brain challenged condition. Studies and observed behavior show approximately 80% of all cognitively and emotionally impaired condition has a temporal lobe disordered blood flow. Cerebral ischemia is a known effect of mycotoxin toxicity and also disordered cognitive and emotional processes. Synthetic chemical drug treatment creates its own toxicity and metabolic neuropathy and can exacerbate behavior, physiological symptom. Such treatment robs histamine and corresponding correct neurotransmitters. A drug and a chemical create a greater amount of endotoxin, having its own acute and chronic effect on cerebral circulation, exposing the brain to hypoxic, acidic, ischemic effect on cerebral circulation. Exposing the brain to hypoxic, acidic, ischemic injury and its own toxicity, as well as acute vasoconstriction and prolonged vasodilation. Exposure to heavy metal, solvent, pesticide, insecticide, nitrosamine, carbon monoxide, and mycotoxin cause neuropsychiatric deficit, as shown with SPECT, single photon emission computed tomography. Significant hypoperfusion defect is seen by such a brain scan of a person with chemical toxic exposure. Mycotoxin doses as low as 0.13 milligrams per kilogram causes histological lesion. An antifungal life food nutritive therapeutic protocol shows an improved condition compared to no treatment. Most all cognitive and emotional challenged condition is a condition of dyspepsia, fatigue, involving digestive disturbance and lack of proper bile flow. Bile flow keeps mold at bay in the intestinal tract. Otherwise, acidity of blood, alkalemia of blood, and excess L-lactic acid becomes pronounced. Peripheral vasoconstriction of hands and feet and extremities, gastrointestinal upset, hypothermia, hallucination, suicide, homicide ideation, apathy, and low cerebral blood pressure result. Differential isopathic assessment in dark field microscopic investigation by this author and others shows in colloidal biology that life colloid pleomorphic variant have a regulator form that reverses dysbiotic, more advanced life colloid beyond the double spore stage. See Jubbs cell rejuvenation, also page 10 of this work. Mycotoxin causes hypoperfusion and lack of regional cerebral blood flow, RCBF, by induced constriction on capillary blood flow, creating neural vasospasm and multiple focal decreases in perfusion. A change in RCBF baseline correlates with a measured capacity to learn new behavior. Orbital and dorsal prefrontal cortex cerebral hypoperfusion is involved in dysphasia and ADHD. Xenon 133 inhalation and emission computed tomography does display the above condition. Low metabolic activity is involved in the periventricular white matter and border zones between major arteries in the frontal cortex, compromising one's executive guidance behavioral function. RCBF has been studied by 99-MTC MPAO brain SPECT, MRI, and RRG, and functional defects in prefrontal cortex and limbic and somatosensory and cerebellum during resting states. This has been shown in ADHD children. Cerebral glucose metabolism is vital, as has been studied by positron emission tomography, PET, and shows potential for humans to have, because of mycotoxin and celiac, a decreased global absolute prefrontal and anterior paralimbic cortical blood perfusion. All studies point to a prefrontal hypometabolism in treatment of resistant rapid cycling behavior. Cerebellum, posterior, cortical, normalized hypermetabolism is shown in all bipolar subgroups. Delayed word recall is associated with depression, low blood pressure, and diabetes, and excess fibrinogen level. Apathy is shown in prefrontal and anterior temporal dysfunction. Reduced regional cerebral blood flow is shown in schizophrenia by magnetic resonance. Pathology and dysfunction is shown by hypoperfusion in widely distributed neocortical limbic neural network. With such brain scans of emotional and psychotic persons, unique dysphasic syndromes correspond with hypoperfusion and occupy numerous brain regions as indicated, including the caudate nucleus. All are consistent with hypoxic ischemic event origin. Hypocapnia, overbreathing, is also shown to create hypoperfusion of brain structure and globally alters brain function. Thought disorder and grandiosity is generated by hypoperfusion of bifrontal and bitemporal RCBF. Delusion, hallucination, and distrust is correlated negatively with singulated left thalamic, left frontal, and left temporal RCBF. Cognitive and emotional challenge is associated with hypoperfusion of the brain. The author has applied herbal remedy, antifungal, and digestive rejuvenation to a much improved result, clearing cerebral hypoperfusion related to intestinal hyperemia, celiac, and bile occlusion. Hemisphere compensatory mechanism is engaged as occlusion of the bile bladder exists. Otherwise, foodstuff eaten ends up as mold and mycotoxin and causes cerebral hypoperfusion. The author has seen in an anti-mold program applied over 6 months, gluten, gliadin, glutenin, casein-free diet, to witness regression of regional cerebral hypoperfusion and schizophrenic symptom. Herbal remedy, including ginkgo, skullcap, and periwinkle, alleviates cognitive impairment by increasing perfusion of the brain. Magnetic therapy also increases microcirculation of the brain. Just getting enough vitamin D assists, for the institutionalized suffer artificial light. Mitochondria in the brain is a major target of numerous mycotoxin. Hypothermia of the peripheral body is quite noticeable usually and is evidence of brain hypoperfusion, low blood flow. A diet high in tannin bind with carbohydrate, robbing the body of necessary serotonin, and also often triggering migraine headache. Tannin is bitter, astringent, molecular weight between 500 and 3,000, is divided into two groups, hydrolysable and condensed, and each bind to protein, starch, cellulose, and minerals, causing a lack of absorbed nutrient supporting brain and body cell respiration. Lysergamide is only one mycotoxin from moldy grain and has a vasoconstrictor activity on 5-HT2 serotonin receptors. Numerous such mycotoxin is found on grain that mold easily in a damp, wet climate. Such stored silo food is always contaminated such. Panax ginseng and Jubbs longevity formula has a neuroprotective element from psychotropic agent that increase blood flow and protects against mold. Phenolic compound in excess interfere with serotonin pathways. Tannin in excess makes low level of usable serotonin bind to carbohydrate. Tannin in excess also binds to the digestive tract. Proline, an amino acid, is affected the most. Excess estrogen, xenoestrogen, creates a greater impact on brain function when tannin is excessive and mycotoxin is present. Vasoconstrictive tannin, as is carob bean gum, and also numerous other food additives can have a deleterious effect on brain neurotransmitters. Ergotamine and aflatoxin and related mycotoxin compound cause vasoconstriction, as does various alkaloid produced by claviceps, all grown on a grain and bean in a damp, wet, moldy condition. Life Food is without grain and bean and is vegetarian, with a focus on life force as a nutrient. Heat over 118 degrees Fahrenheit destroys this property, and also changes the three-dimensional structure, stereoscopics, of the food, causing nutrient creates hydrogen-linked, cooking nutrient creates hydrogen-linked bonds, destroys enzymatic activity, and causes food eaten such not to be miscible with water. Hydrophobic. Mycotoxin can have got a foothold in the brain and gut, causing the whole body vasoconstriction and reduced energy metabolism. Decline in HB and CYTAA3 and PCR and ATP and other cell respiration nutrient. Neurodamage in cerebral cortex immunohistochemically occurs beyond 3 minutes of a hypoxic acid bioterrain. Cutaneous mucormycosis can be caused by numerous zygomycetes. Rhizopus arhizus can cause cirrhosis, renal failure, in those with ischemia of hands and feet. Diagnostic evidence shows this. Headache, confused thinking, decreased alertness and dehydration, loss of overall water volume of the blood, low blood pressure, and hypertension are symptoms of unchecked mycotoxin. Mycotoxin unchecked interferes with serotonin pathways. Ergot produces ergotamine and LSD-25, and this is only one of the mind-altering neurotoxin produced by moldy grain and bean. Also to a loss of intestinal flora that produces SOD and glutathione peroxides. Both antioxidants are vital to proper brain perfusion, especially the executive guidance area involving the frontal cortex. No polyunsaturated fat and only body-ailing saturated fat can make a red blood corpuscle membrane inflexible and results in reduced blood flow in the microvascular system. Mycotoxin can cause autoimmune cross-reaction with neural structure and protein essential for proper brain function, including a loss of MIG protein coupling in the frontal cortex. This is rated highly in determining cognitive decline. Streptozotocin toxic infection downregulates muscarinic receptors. causing frontal cortex executive guidance neurology to no longer properly function because of affected neurotransmission. Manic depression is associated with strongyloids, a parasitic worm, roundworm. The tiny larva of this parasite causes neurological symptoms, including recurrent and prolonged headache. Chlorinated shower vapor can cause this parasite to have invaded the frontal cortex through compromising the nose. Brominated flour, bleached flour, and also fluoridated toothpaste compromise the cell-mediated immunity. Platelet hyperactivity, clumping, can cause ischemic cerebral condition, and fungal infection is a common causative factor. Parasite infection is also. Food allergy, stress, and biochemical imbalance is correlated highly with brain hypoperfusion. Substance P is released when endorphin, naturally produced opium-like information molecule, is low, creating vasoconstriction. Mold interferes by ensured lower DL-phenylalanine DLPA. DLPA is critical in serotonin regulation and brain use of such. L-glutamine gut protection is also affected, thus no inhibitory neurotransmitter. Trigger food is food triggering psychotic and neural disorder and includes grain, bean, and milk mycotoxin, and dietary amine containing food, including cheese, chocolate, and alcohol. Mold infection of the gut, intestine, bile, bladder, and brain rob magnesium and cause excess estrogen, creating hysteria. Salmonella and Shigella cause gas and bloating and is always found in deli food, flesh, butter, cheese, and yogurt. Shigella can cause quick anger, irritableness, and numerous nerve conditions. Hot and cold water treatment release endorphin and increase natural cortisol. Proper intestinal flora creates L-glutamine, otherwise deficiency exists, and beryllium and ergot alkaloid cause chronic depression, and combined with heavy metal toxicity can cause numerous physiological and mental emotional symptoms. Burning sensation, suicidal and homicidal ideation, confused thinking, bipolar condition, belching, water retention between cells, dehydration of blood by mineral deficiency, and water volume loss, distended abdomen, schizopsychotic, and delusional points of reference. White cells can be outside a normal reference range generally, and hematocrit, lymphocyte, serum total protein, and triglyceride abnormality can exist. Also low blood pressure. Nitric oxide, carbon monoxide, and hydrogen sulfide. As essential gaseous compound, regulate normal brain function. Fungal metabolite found in the blood and stool characterize dysbiotic gaseous compound and relate to an exacerbation of bipolar disorder. Cognitive and emotional long-term challenge involves a metabolic neuropathy, and a true healing therapeutic involves assisting on a physiological level. Low EFA, vitamin B and D and C and E can cause each of itself challenge on the above level. A hypoxic acidic microneach can initiate nerve cells and connective tissue to aggregate, fuse, and differentiate AFD by reverse differentiation and to pleomorph into any number of dysbiotic bacterial, mold, fungal, and yeast life colloid, internal and external of a brain cell. Mold and fungal life colloid as Saccharomyces cerevisiae, interior of the body and blood, can cause suicidal, homicidal, and confused thought, hope, despair, ideation. Such a person's plan, means, lethality, availability, barriers, and support system is vital. Cell rejuvenation is a process, not an event. Metabolic neuropathy requires an anti-mold fungal approach. Vitalization of the intestinal tract and exercise to increase blood flow to the brain. The life colloid probiotic initiates healing on many levels, including downregulation of pathogenic mold and fungus. Life as a human being has a vital relationship of recapitulation of a mutual lived assistance with mucorrhizmosis involved pleomorphically in blood clotting and vascularization, and Aspergillus niger involved in the formation of bone and solid tissue as connective tissue. These life colloid live in symbiotic relationship, yet not in a dysbiosis, acidic hypoxic bioterrain. These symbiotic life colloid put into a fermentive bioterrain become in dysbiosis a stealth pathogen that can easily escape an antibiotic and turn from mutual lived assistance to its own demise. As a stealth pathogen, it can shed its antigenic markers and become an acid-fast, cell wall deficient life colloid. For this reason, one must consider the bioterrain in healing a metabolic neuropathy. Motivation to change and the ability to form a new stable pattern of behavior aims to change behavior and effective response by teaching coping skill through whole brain functioning training that directly addresses and modifies dysfunctional thought pattern. One's ability to respond is dependent upon cognitive flexibility, yet proper RCBF is critical to be restored. Otherwise, a healthy neural cell can pleomorph into Fusarum solani, Mortadella wolfii, and mucorrhizmosis to cause mold in areas of the brain, as in the nose or any other organ. Antifungal formula containing osmotin is vital and necessary, as in the author's longevity formula and other formula, and also Jubbs probiotic life colloid. On such an approach, one becomes immune-wise, flexible, and integrated, and self-realization, eye-awareness is, and one is social. This antifungal consideration, taken care of, is seen to clear away fixed delusion, paranoid thought, and social withdrawal by stopping element creating hypoperfusion and also normalized hyperperfusion of the brain. The bioterrain is typically in need of restoration by life colloid probiotic antifungal inoculant such as amphotericin B. Jubbs life colloid probiotic has Streptomyces nodosus-like life colloid similar to soil of the Orinoco River basin in Venezuela. Amphotericin B downregulates pathogenic mold, fungus, and yeast-like dysbiotic life colloid that abandon their mutual lived assisted role and can have instead turned to their own demise. Dysbiotic pathogenic life colloid have a mortal oscillatory rate that can be applied for a symbiotic life colloid in a hypoxic acidic terrain can have become dysbiotic as mucorrhizmosis. Otherwise, healthy cell life colloid can differentiate into a dysbiotic bacteria as borreliosis and also mycoplasma pleomorphically. IgA and IgM antibody is generally elevated in a metabolic neuropathic state. And as indicated, Babesia, Borrelia, Burgdorferi, mycoplasma, fermentins like dysbiotic life colloid can be found interior of the body and are downregulated by Jubbs life colloid inoculant. Cleansing can cause ketoacidosis by itself when not bringing in and doing life food nutritional fasting involving liver and gallbladder flushing and castor packs. Old baker's yeast, flesh, fish, banana, pineapple, date, sugar, corn, rice, potato, beet, carrot, peanut, cashew, grain, bean, milk, egg, and cooked food should be eliminated as none of that can eco-sterilize against dysbiotic life colloid and generally is cooked to possess no life force. Zygomycetes is a fact of metabolic neuropathy. Antifungals such as Agraicus, Muscarius, 6X, Mucan, and magnesium oil and other nutrient can assist to clear pathogenic mold. Otherwise, the executive guidance neurology can have become infected from inside out. One must consider a 6-month protocol vigilance with to heal metabolic neuropathy. One must take the path of least resistance. It is of construct validity and reliability that a metamatrix blood profile, combined with body reading of physiology and a cognitive profile, and then combined with compassionate experiential whole brain functioning, behavior, reconditioning, and an anti-mold approach that one can be assisted the most. One must clear away as much non-biophotonic consumption of life food and chemical as you can, and always reduce toxic burden to heal a metabolic neuropathic condition. Yet a metabolic healing is extremely important and all natural compound can be applied. Careful to reduce tannin from superfood and other compound in excess, as in excess green. A metabolic neuropath is a recovery process and requires a multidisciplinary approach. True informed consent must apply what has construct validity and is repeatable herein. Dyspepsia fatigue is a serotonin syndrome and can cause confused thinking, hypothermia, sweating, twitching muscle, dilated pupil, seizure, goosebumps, irregular heartbeat, headache, and loss of food and motor coordination. Chemical synthetic excess serotonin can accumulate to be a factor in cognitive and emotional impairment. Inadvertent interaction between a chemical synthetic given can also cause serotonin syndrome and toxicity, and cause a spectrum of specific symptoms ranging from fatal to slightly perceptible. Moderate serotonin intoxication includes hyperactive bowel sound and also hyperthermia and a 104-degree temperature, hypo and hypertonic reflex, metabolic acidosis, and some somatic effects. Tachycardia, nausea, diarrhea, shivering, hyperthermia is of an autonomic effect, and hallucination, agitation, confusion, hypomania, headache, and coma are only some of the cognitive effects of serotonin syndrome from chemical synthetic serotonin interaction. Overstimulation of 5-HT2A receptors contributes substantially to this syndrome. Synergistic increase of synaptic serotonin MAOI inhibits monoamine oxidase irreversibly until non-functional unless it is replaced. 1 month is typical for it to be replaced. Phenotypic variation exists among persons and is associated with unexpected drug interaction. Serotonin syndrome can have been produced as indicated by antidepressant, opioid, central nervous system stimulant, psychedelic, herb, and other psychoactive synthetic chemical. Diagnosis of serotonin toxicity is by careful history of observed physiological effect. There is no diagnostic, yet it is observed and investigated by a person's history and observation of physiological and behavioral change on a pro-serotonergic drug. The Hunter serotonin toxicity criteria must be observed for simple, accurate diagnostic decision. Direct sympathomimetics, as is whole food vitamin mineral complexes having tyrosinase that assist bind epinephrine, norepinephrine. Some drugs have a long elimination half-life, active metabolic and duration of action, metabolic and duration of action can be protracted. Numerous drugs create serotonergic symptom, as does excess tannin in the diet, as does zygomycetes toxicity in human disease. Treatment engages a blood study metamatrix along with a SPECT scan of the brain, saliva, and stool. Breath and urinalysis must be done to rule out a metabolic neuropathic condition, underlying neuropathic symptom. A thorough investigation of a patient's history and drug reaction cannot have been done typically to have had no informed consent. A metabolic neuropathy can have been mistaken for other illness. Only a full physiological testing process can confirm the diagnosis of metabolic neuropathy, along with a brain scan that examines brain blood flow, perfusion. Selective serotonin reuptake inhibitors, SSRI, and selective serotonin norepinephrine reuptake inhibitors, SSNRI. Popular SSRIs include Celexa, Zoloft, Prozac, Paxil, and Lexapro. SNRIs, as is Effexor, Cymbalta, and also triptans, given for migraine, include Imitrix, Relpax, Exert, Emerge, Megxalt, Frova, Zomig all can cause excess serotonin to be present in the brain. Only three symptoms are necessary to be diagnosed with serotonin toxicity: mental status change involving confused thinking, agitation, hypomania, shivering, fever, tremor, shivering muscle spasm, overactive reflexes, heavy sweating, uncoordinated movement, diarrhea. Symptoms of nausea, increased body temperature, rapid change in blood pressure, loose bowel, hallucination, fast heartbeat, agitation and restlessness, confusion, often observed within 10 minutes of taking a serotonergic chemical as a syndrome is present. Drug combination induce an abnormal serotonin level leading to serotonin disorder. Discontinuing drugs causing this condition must be done over time, and an alternate therapeutic involving detoxification and fortification of brain fitness must be concurrently done. It is suggested that one apply uropathy and a paired conditioning response to be put herbally. Serotonin syndrome signs include mental status change, tetchiness, easily annoyed and agitated, sleep disturbance, drowsiness, lethargy, disorientation, incoherent, irrational, illogical, impatient, oblivious to surroundings, contemptuous behavior, petulant, dispositive, peevish, grumpy demeanor, fainting, loss of awareness of surroundings, swift movements, stiffness, twitching, abdominal pain, liquid bowel movement, excessive sweating, hyper and hypotension. This is as one has or is taking synthetic chemical that increases serotonin. Serotonin syndrome must be considered until it is ruled out. Serotonin syndrome is diagnosed by comprehensive history assessment and observation of drug taking, and its immediate and long-term effect on physiology must be noted for informed legal consent to be given when evaluating a person on antidepressive, antipsychotic, and migraine headache and synthetic drugs. Otherwise, a person's condition can have gotten slowly worse. Only a life food diet, exercise, detoxification, avoidance of harmful substance, and emotional stress can balance the brain's ability to make enough serotonin naturally. A dopaminergic synthetic drug that blocks dopamine receptors can create a granulocitosis, low white blood cell count. Baseline WBC ANC count must show no abnormality of blood, for clozapine and dopamine inhibitors have their own direct physiological pathology. Low nutrient, as in a metabolic neuropathy, can interact with a synthetic drug to further reduce an essential brain nutrient. For instance, clozapine reduces L-tryptophan and selenium. Loss of N-acetylcysteine, vitamin C, glycine, and glutathione peroxidase can be exacerbated by Haldol-like synthetic drugs that have a sedating effect, and can be synergistic with other benzodiazepines with anticholinergic effects, including orthostatic hypertension and gastrointestinal hypomotility. Clozapine binds to serotonin and dopamine receptors. Haldol binds to dopamine receptors and can cause tardive dyskinesia, involuntary muscle spasm. Dopamine receptors abnormally can increase up to 90% more than normal, and long-term effect is unknown, yet zombieizes. Severe toxic central nervous system persons should never be given haloperidol, Haldol. No studies have been done on long-term use, nor what occurs on a cocktail of other synthetic chemicals with Haldol. Considerable evidence indicates that zygomycetes infection is associated with reduced transcriptional efficiency, resulting in reduced serotonin expression and uptake and dopamine serotonin axis imbalance. Psychiatric and genetic factors implicated in mycotoxin excreted by zygomycetes infection of the gastrointestinal tract, and dyspepsia fatigue, and must be corrected to effect a healing from a metabolic neuropathy involving the serotonin dopamine axis. A predisposing condition in childhood is metabolic acidosis associated with gastroenteritis. This condition is known to give rise to fungal orbital cellulitis. This condition occurs as the sinuses have become colonized by dysbiotic spore and directly spread or hematogenously spread to the orbit and brain. Functional orbital cellulitis can be found in an otherwise healthy person. Zygomycetes can have invaded cranial nerve areas, including the 11th cranial nerve to the 5th, that engages the vagal enteric nervous system. A metabolic neuropathy engages a wide range of peripheral nerve pathology stemming from dyspepsia, fatigue, and sugar, protein, and a global fat challenge. Metabolic impairment cause demyelination and axonal degeneration. Reduced sodium and potassium and ATP ASE activity and nerve conduction velocity can have become seriously deficient. Changes are incurred in microvascular perfusion to be insufficient, that includes membrane basement thickening. Endothelial proliferation of cells and occlusion of blood vessels. Studies show that antioxidant therapy improves the overall outcome, yet most all cognitive and emotional impairment treatment never considered nutrition, which is a very serious error. Persons suffering a metabolic neuropathy can experience peripheral body parts to tingle and have numbness, cold feet and hands. Skin can be clammy. Nerves of the extremities are often involved, including carpal tunnel syndrome. Pain and paresthesias is not uncommon. Pain can radiate down an arm. Injury can occur to large and small nerves. Symptoms that can easily be read involve eyelids being puffy, miosis, pupil dilation, fast heartbeat, arrhythmias, postural hypotension, thermoregulatory disorder, abnormal vasomotor response to change of temperature, alimentary tract disorder, burning pain, abnormal sweating, postural blood pressure changes, weakness and fatigue, muscle cramp, and restless leg syndrome. Common causes are dyspepsia, fatigue, bile occlusion, uremia, amyloidosis, and low thyroid function are only some of the causes. Yet fungal dysbiosis and bacterial dysbiosis of the intestinal tract and accompanying mycotoxin vasoconstrictor is the most common causes of a metabolic neuropathy. The consumption of indigestible protein such as gliadin, gluten, glutenin, and casein are common culprits that cause celiac and irritable bowel syndrome. Celiac is highly related to behavioral dysfunction, apathy and irritability. Attention deficit disorder and psychic abnormalities are common to celiac disease. Such a person shows no joy and it is difficult to engage in play behavior as a child and adolescent. Facial expression generally shows a lack of joy. Both dopamine and serotonin are involved in regulating behavior in the extrapyramidal cells, including the substantia nigra, striatum, and pallidum. Selenium glutathione peroxidase is made in the gut by the symbiotic intestinal flora and is vital to the above proper functioning brain regions. Celiac is a condition of intestinal dysbiosis and low glutathione peroxidase. Amine imbalance in the celiac disease correlates highly with psychiatric illness. Anxiety and depression correlate highly with celiac. Celiac is an inflammation of the mucous membrane of the intestinal tract as a reaction to the consumption of strange indigestible protein. A connection exists because of malabsorption and its direct effect on brain function. Gastrointestinal vitality affects brain function. Glutamine is not produced in a dysbiotic intestinal condition, and deprivation of exogenous and endogenous glutamine decreases transepithelial electrical resistance, and it destabilizes intercellular junction integrity and tight junction proteins, causing fungal hyphae to easily gain a foothold in the intestinal tract, producing mycotoxin that vasoconstrict and cause hypoperfusion of the brain and body. A drug-resistant person having epilepsy and cerebral calcification can have been healed on a celiac-free diet. All healed had an atrophic Jejunal mucosa. Brain calcification is recognized in brain and psychiatric disturbance. Gluten has been shown as a culprit in brain disturbance. Adverse impaired brain function occurs in celiac disease. And calcium phosphate deposit can be found throughout the body and creates a condition of silent inflammation. Gluten, glutenin, gliadin, and casein can seriously disturb the brain. These indigestible proteins are neurotoxins. These neurotoxins damage the delicate brain networks of the vagal enteric nervous system. There is as many nerves in the brain as there is in the gut, some 25 billion. A diagnosis of IgA gliadin 9 is a gluten and gliadin sensitive person. Celiac disease is an inflammation of the small intestine resulting from strange indigestible protein. More than 90% of celiac disease sufferers have the HLA-DR3-DQ2 halotype gene. Fungus, infectious agent, and immunological challenge is also involved in celiac disease. A diagnosis generally requires a biopsy of the jejunum to demonstrate villus atrophy, yet typically this can be a hit and miss situation, yet can be easily read by morphological tissue change of the bottom lip of the mouth and from palpitation of the small intestine and from a detailed history. More than a third of celiac disease sufferers also suffer from mental and behavior disorder. A decrease in circulating IgA anti-transglutaminase antibodies improves psychiatric condition and correlates with reduced psychiatric treatment. Malabsorption corrected of important nutrients such as B6, folate, and B12, including tryptophan, leads to improved psychiatric outcome in central nervous system serotonin function, and reduced mycotoxin is associated with relief of depressive and psychiatric disorder. Low levels of CSF5 HIAA is linked to anxiety and depression and aggression and is relieved greatly on a live food diet free of strange indigestible protein. Cytokine inactive celiac disease shows higher than normal production of interferon gamma, IFN. Specific cytokines trigger brain compensatory change, including behavioral change, resulting in mental and emotional detriment that improve on a live food diet, gluten, gliadin, glutenin, and casein free. Villi increase surface area for absorption of nutrient. Mold from indigestible protein can pleomorph into fungal hyphae to cause a leaky gut, and an autoimmune condition can also arise to cause atrophy of villi. That brain nutrient is not present, and as indicated here in mycotoxin, is a vasoconstrictor from such celiac causing food, causing hypoperfusion of brain areas, especially in the frontal cortex. A bloated stomach and gas is immediate. Symptoms are diverse, yet fatigue is very common, including adverse skin condition. One who has celiac cannot have any strange indigestible protein. Villi and papillary-like projection along the mucosa of the small bowel become non-existent. In celiac, villi and papillary projections disappear. Celiac and sprue also cause all surface area of the small intestine to be flattened and for inflammation to further reduce absorption area to create a serious situation of malabsorption. Without proper nutrient, intestinal flora become dysbiotic, life colloid, spore, bacterial, mold, fungus, and yeast. Hypoperfusion, as indicated, and malabsorption of nutrient because of celiac go hand in hand to create mental and emotional challenge. All nutrient goes to support cell respiration, and without proper nutrient, a hypoxic acidic bioterrain arises, and a 10,000-headed monster arises, including a metabolic neuropathy. Dyspepsia, fatigue, celiac, sprue, and accompanying metabolic neuropathy is the diagnosis of exclusion. That a metabolic neuropathy from strange indigestible protein has been excluded, otherwise it is highly likely that this does exist. In the Middle Ages, cognitive and emotional challenge was called Saint Anthony's fire. The only healing mentioned in the literature was fasting. Only civilization that ate grain and bean in the past have mental disorder. No evidence of mental and emotional challenge exists in society that does not eat grain and bean. A grain and a bean has no ability to eco-sterilize against mold fungus in the soil, and that overcomes these plants if left to nature. Barley has hordeins, rye has cichulins, all strange indigestible storage proteins. Gluten is the popular name for a protein present in certain dietary grain. All grain and bean has storage protein that cannot be broken down and have disaccharide that end up as a sugar in the blood, not managed by the liver, increasing the burden on the pancreas that releases insulin. Insulin release causes somatostatin to be released by the anterior pituitary, and this blocks human growth hormone. Some people are genetically more sensitive to strange indigestible protein symptoms, and minimum damage to severe symptoms to marked damage occurs from consumption of grain, bean, and milk protein. A chronic symptom is obvious where mild symptoms can be managed. Yet celiac can also be silent where no apparent intestinal symptom exists. Specific HLA, DQ genes, and DQ2 or DQ8 genes are always found in celiac, and IgA tissue transglutaminase antibody, IgA-TTG blood test can screen for celiac disease. Yet distension and dyspepsia, fatigue, and dysbiosis of the intestinal tract can easily be recognized by a history taken, and palpation and percussion of the abdomen. Dermatitis, herpetiformis, hypoglycemic and hypoglycemic and hyperglycemic minimal and primary brain dysfunction, primary biliary cirrhosis, microscopic colitis, autoimmune disease, arthritis, cardiovascular challenge, and numerous other conditions can all be caused because of a dyspepsia fatigue. Mold, fungus, yeast, and celiac is the most common denominator in disease of human beings and is related to each other. Brain optimization through Jubbs cell rejuvenation. Chemical dependency and adversive behavior is a symptom, not a diagnosis, and is derived from attempting to normalize the brain's chemistry and electrical activity. A biochemical craving is not a character flaw, yet a biochemical craving optimizing brain chemistry by correcting brain cell respiration nutrient clears away trigger behavior. A drug can temporarily cause one to perhaps feel normal, yet one's condition is not a shortage of a synthetic drug. Jubbs cell rejuvenation clears away craving by optimization of brain nutrient and clearing away the underlying cause of one's chemical dependency. An underactive prefrontal cortex can be secondary to genetics, where ADHD gene causes an overactive COMT enzyme that deactivates dopamine. When overactive, a localized dopamine deficiency can have incurred. Brain compensatory action can cause normalized hyperperfusion of various brain regions, including cingulated gyrus. This can cause a hyperfocus on adversive thought and memory with reduced septal function and increased amygdala neural processing, creating numerous behavioral disorders. Excess worry and anxiety is caused because of serotonin being not in balance, and this causes an overactive anterior cingulated gyrus. Mold, fungus, and yeast can have taken over a person's digestive tract, causing mycotoxin and other inflammatory agents to be wrongfully present. That shuts down serotonin production in the brain of the gut. Anxiety can have been produced because of low serotonin, because enterochromaffin cells that line the small intestine mucosal lining can be severely compromised on a non-life food diet. Hypoperfusion can become normalized in various brain regions where the cingulated gyrus and deep limbic regions, as is the amygdala, can have become overactive. Serotonin can only activate receptors in the brain as estradiol and progesterone is sufficient. Estradiol below 60 pg and low progesterone causes numerous metabolic neuropathic conditions, including loss of conversion of allopregnanolone, allopregnanolone necessary to activate GABA, that naturally quiets the brain activity and allows proper sleep pattern. A low brain level of dopamine and serotonin can be caused by a chemical addiction. Jubbs cell rejuvenation is an anti-aging program and balances necessary neurochemicals naturally that stops drug craving and unnecessary synthetic chemical replacement. No stimulation of underactive brain regions, no understimulation of overactive brain regions is necessary as a metabolic neuropathy, properly diagnosed, can be healed. And this is confirmed by correlated SPECT brain imaging and saliva, blood, and urine profiles taken. Electrical brain dysfunction is corrected on Jubbs cell rejuvenation therapy as underactive and overactive brain regions become normal. Chronic exposure to neurotoxin, as is mycotoxin from dysbiotic spore, bacteria, mold, fungus, and yeast, and heavy metal is cleared away. One cannot talk a way out of biochemical imbalance and its accompanying metabolic neuropathy. Today it is known that catechol O-methyltransferase, COMT, inactivates dopamine nerve synapses. An intestinal dysbiosis from dyspepsia fatigue causes low methionine that is necessary to make regular COMT, yet the amino acid valine is substituted, and it produces an overactive COMT that is 4 times more able to break dopamine down. Otherwise, excitatory neurotransmitters can have easily become excessive, and glutamine and histamine can have become excitotoxic. Stachybotrys, black mold, can of itself cause severe anxiety and sleep disturbance. Metabolic neuropathic symptoms can have been medicated for, and detoxification from having been medicated by self and doctor prescribed needs to be done in conjunction with balancing brain nutrient. Otherwise, sudden removal without proper brain support can cause trigger behavior to arise. True recovery requires the brain to be supported by proper nutrient and the body detoxified at the same time. Drug metabolite is cleared away by increasing the body's ability to cleanse and also sweat. Typically, by 14 days, no metabolite can be found in the sweat, and none can be found in the urine after 40 days. Jubbs cell rejuvenation is a life food nutrient based brain restorer and detoxification program. An alcoholic is generally deficient in potassium, folate, and thiamine, B1. Only a life food program can restore vitally these nutrients, yet mold, fungus, and yeast must be dealt with by causing natural bicarbonate of soda to be released by the liver. The author has assisted thousands of persons by Jubbs cell rejuvenation process through introduction of proper nutrient, cell cleansing, hydration, rest, and exercise. Electrolyte therapy is necessary for proper hydration. Jubbs cell rejuvenation has distinct phases of stabilization, tapering of chemical dependence, and discontinuation. Adventure-based experimental learning is engaged during this time to empower one to live life more fully. As one learns, whole brain functioning, syntax, and behavioral shortcoming is cleared away, and one heals up. As indicated above, life food is strange and digestible protein and stops poor absorption of tryptophan that the body applies to make serotonin. This is, as indicated, is often extremely low in celiac and sprue and irritable and leaky gut syndrome, and causes addiction to bread, cheese, and sugar food, ice cream, and chocolate. Anxiety, epilepsy, dyslexia, social phobia, and impaired sensory function, and ADHD combined subtype, including poor memory, inattentive, detail attention distraction, and task completion. Hyperactive, impulsive, as is uncontrolled speech, and also fidgeting. The author has seen dramatically reduce and clear up on a live food diet and completing Jubbs cell rejuvenation 14-day program that applies gallbladder and liver flushes, castor packs, and antifungal herb support. The author herein gives the reader some of the primary components behind considering mental and emotional challenge being a metabolic neuropathy, and that such a symptom is not a diagnosis of such. Yet three symptoms presented herein can point to a metabolic neuropathy. Along with environmental factors, in considering a metabolic neuropathy is a genetic consideration, including an overactive COMT gene mentioned above, and also cyclic adenosine monophosphate responsive element modulator, CREM, that regulates melatonin, is secreted by the pineal gland, and ADHD persons have abnormalities of the CREM gene. Getting natural light early in the day often of itself corrects abnormal day-night differentiation. Otherwise, daytime sleepiness occurs by overactive production of melatonin. Jubbs cell rejuvenation involves re-establishing proper circadian cycle by applying neuropathy and normalizing use of a natural wake and sleep cycle. ADHD persons are generally suffered of sleep disturbance, and increased chronic nutritional and emotional stressors affect normal melatonin production and secretion. Whole food vitamin mineral supplement of vitamin C has an abundance of typosine and increases alertness in psychotic and emotionally challenged persons that has a calming effect. Dopamine is produced by tyrosine element ingested. Low vitamin C, natural, can have led to low dopamine level of the brain that is corrected on Jubbs cell rejuvenation. Enuresis, bedwetting, ADHD, and psychiatric challenge such as oppositional defiance, exhibited disobedience beyond normal to parenting and or authority. Frequently occur with enuresis alongside of depression, obsessive compulsive anxiety, nervous tic, nail biting, bruxism, and conduct disorder. Vagal enteric nervous system function can have become compromised in conditions of dyspepsia fatigue that block proper sympathetic and parasympathetic regulation of body function. The author has seen on a live food diet all such symptoms disappear and clear up. Many symptoms clear up the moment dyspepsia fatigue is resolved. The author has seen the longevity formula applied by itself to see greatly reduced above such symptoms. A marine mineral formula having an abundance of iodine assists body temperature and clears away cell-impaired respiration. Raised TSH levels have been reduced applying whole food vitamin mineral complex of iodine from Jubbs marine mineral formula. Food allergy must be cleared up, otherwise brain electrical activity results in ADHD symptoms. Jubbs Life Colloid Probiotic has numerous nutritive vital elements, including carnitine and coenzyme Q10, is very important, along with omega-3 supplementation. Most brain-challenged individuals have only 1,000 species of life colloid in the intestinal tract, when there should be some 80,000 species in good health. Jubbs Life Colloid Probiotic has some 50,000 species. Most probiotics can only have at most 12 species. This when you require 80,000. Jubbs Probiotic Life Colloid can reprogram mineral-starved cells, provide vital brain nutrient, and assist to clear growth of commonly occurring dysbiotic mold and fungal filamentous zygomycetes. This has been shown to clear away allergic responses to immunosuppression and cancer. Mycotoxins such as aflatoxin, ochratoxin A, fuminisms, crucosines, and zearalenone cause a variety of ill effects that all clear up with the use of Jubbs Life Colloid Probiotic. Commonly found mycotoxin mostly come from grain, bean, and dairy that non-life food is eliminated and is not able to ecosterilize against mold. Epidemics of ergotism have caused many deaths and, as indicated here, is responsible for mental and emotional decline. Mycotoxin is a metabolite of fungus and is a bizarre molecule including single heterocyclic rings to irregular arranged 6 to 8 membered rings. Mold grows on cereal crops, and corresponding mycotoxin is acute, chronic, mutagenic, and teratogenic. Many mycotoxins cause liver, kidney, brain damage, and death. A. flavus and A. parasticus have an affinity for cooked pasteurized nut and oily seed. Marked neurotoxicity is evident in aimless walking and loss of muscle and nerve tone. F. graminearum, found in wheat, barley, maize, and corn, cause genital abnormality and decreased libido. It is difficult to escape. The conclusion here in that food-borne mycotoxin must be eliminated in physical and mental health revitalization. Mold DNA has been found in biopsy from the brain, liver, and skin and lungs from decreased and living hosts made ill from exposure to mold. Fusarium fungus produces the mycotoxin zearalenone that has a serious pronounced estrogenic effect on a contaminated body and can arise from white sugared food having been allowed to ferment. This wreaks havoc on noradrenaline formation from dopamine and catecholamine turnover rate of the brain. Therefore, on Jubbs cell rejuvenation, one has a focus on antifungal therapy, which should last for some 6 months to effect a total healing, while applying cell rejuvenation therapeutics. Calmodulin is a calcium-binding protein found in high concentrations in the brain and plays a pivotal role in brain cellular function. Mycotoxin is an extremely low concentration that interacts with numerous brain chemicals compromising vital activity, including, among many physiological challenges, calmodulin. Mold in buildings include Aterraria, Cladosporium, Aspergillus, Penicillium, Stachybotrys, and Curvularia. Abnormalities are usually found in T and B cells in 80% of patients who have building toxic shock syndrome. An ozonator and ionizer in the room of a metabolic neuropathic condition assists greatly to relieve mental symptoms. A live food diet free of cereal, grain, bean, processed food, flesh, cooked food, egg, and dairy is important to assist a metabolic neuropathy to heal up. Silages of stored grain is never without mold and fungal contamination. Clinical dependency on a chemical and non-live food is a symptom of the body attempting to normalize brain chemistry. Live food nutritional fasting along with gallbladder and liver flushes cause a great improvement. This paper provides conclusive evidence of how Jubbs cell rejuvenation and anti-mold supplement is efficient in assisting to clear metabolic neuropathy, and how zygomycetes and celiac must be corrected, and also ruled out in human disease. Odor sensitivity is a tip-off, as is the numerous other symptoms described here, which is only a partial list of symptoms of mycotoxin-challenged neurology. Atrial fibrillation of an intractable kind may not be controlled by an antiarrhythmic chemical, yet clearing away causative toxin by live food nutritional fasting can heal this up. One cannot underestimate the role of zygomycetes and celiac in human disease, and especially in metabolic neuropathy. It must be ruled out. Otherwise, one can also be sensitive to drugs given. An index of reduced neutrophil activity is always a sign of universal reactor, and odor sensitivity is such a tip-off. Lymphocyte subsets and gamma globulin is generally suppressed. Jubbs cell rejuvenation and a live food diet is very important, as more than 75% of the immune system and autonomic nervous system is in the gut and is easily disturbed by mycotoxic food sensitivity. Abdominal bloating, stuffed feeling, tiredness after eating, chronic gas, diarrhea, constipation, abdominal pain, irritable bowel syndrome, ulcer, enteritis, colitis, celiac, Crohn's is only a small fraction of disease implicating zygomycetes, mycotoxin infection, and toxicity. Magnesium in a whole food vitamin complex form is vital to bring relief, as it is involved in some 200 detox pathways. Also, some 300 enzyme systems also require magnesium, and in a SAD diet, magnesium is very deficient. Ochratoxin A is a mycotoxin containment that can be found in up to 30% of all non-life food and is detected in the blood of up to 18% of the population. This present paper is an attempt to highlight how dangerous mycotoxin is that is found in non-life food. 1 month after ochratoxin exposure, it can still be found in the kidneys of animals. Gastrointestinal symptoms and throat irritation occurs within 15 minutes of consumption of baked wheat bread contaminated by mycotoxin. Pigs, chicken, and dogs fed such leftover scraps are also severely affected. Maize, wheat, rice, barley, oats, corn, soy, peas, potato, and all non-life food is generally mycotoxin contaminated and must be eliminated from the diet to effect a true healing therapeutic. Fumigation is a toxic mycotoxin found in corn syrup and white sugar product and ingested by all species causes neural dysfunction noted by abnormal behavior in all species having consumed that mycotoxin. Bile flow is optimized on Jubbs cell rejuvenation. Otherwise, manganese can accumulate in the brain. In the globulus pallidi, free radical damage to the brain is common when considering its large lipid content, and bile occlusion must be cleared to effect a healing. Disturbances of the blood-brain barrier by bile occlusion and cell phone usage over 200 hours a month can contribute to ischemic brain episodes. Reactive oxygen radicals and mitochondrial metabolism are implicated in the bile occluded. Glutathione peroxidase and superoxidase dismutase are free radical scavengers produced by friendly intestinal flora. Jubbs Life Colloid Probiotic naturally produces these antioxidants which are very brain protective. Jubbs cell rejuvenation has as its aim to reduce neuronal excitotoxicity, lipid peroxidation, mitochondrial dysfunction, oxidative stress, and improve brain cell membrane integrity, heal disturbance in ion homeostasis, reduce free radical production and subsequent inflammation, and heal ischemic injury. RCBF is regulated by brain nutrient being optimized by a life food diet. All dead non-life food must be eliminated, such as wheat, corn, rice, bean, and dairy. All United States pharmacopoeia isolate as vitamin analogs must also be eliminated, as these toxins have very little biophotonic nutrient and cause a loss of light and enzymatic support systems from the body. Life food is remained with enzyme activity and has DNA and RNA to eco-sterilize against mold in nature. Disease of the gallbladder, bile duct, and pancreas is very common and a major focus in gastroenterology. Wheat, rice, corn, and bean are major culprits in the formation of calculi. Bile occlusion is an unrecognized epidemic. To have good brain function, one must clear away bile and occlusion. Life food nutritional fasting is blended life food. Such nutrient applies optimum quantities of amino acid, vitamin, mineral, and essential fatty acid for maximum well-being and peak brain performance. More blood passes through hypothalamus to assist to regulate neurotransmitter production, vitalizing the gastrointestinal tract through Jubbs cell rejuvenation, through gallbladder and liver flushes, balances amino acid and essential fatty acid synthesis in the gut. Chemotherapy can have been given for cancer and synthetic insulin for diabetes. All comes from a diseased contexted mold. That same model tells us that synthetic antidepressants and antipsychotics restore normal brain functioning by acting on neuropathology of depression and psychotic systems. Alcohol can cause someone who is regularly not social to be temporarily social in the same way. No evidence shows that a synthetic chemical treatment of a mood disorder or rice flour or irradiated psyllium husk cleanse has any permanent or long-term effect except toxification. A true healing therapeutic involves one changing one's ways. Many studies show no difference in serotonin uptake between drug-induced effect and amplified placebo effect. Changes in rating scales applied by chemical drug companies merely is an effect that is drug-induced. Studies do show that a drug treated person has more frequent depressive episodes and longer-lasting episodes than a non-drug treated person. Antipsychotics create dysphoria and depressive symptoms. In the short term, taking a synthetic sedative or a synthetic painkiller or a synthetic sleeping pill can have some momentary efficiency. Short-term synthetic benzodiazepine may be justified. Yet one bears in mind a synthetic dependency. Yet several synthetic drug classes, including induce psychotic indifference, and this effect is adverse. No synthetic antidepressant has ever been shown to organize long-term elevation of mood. And the term antidepressant should be abandoned. The author proposes here in a model consistent with brain conditions being a metabolic neuropathy and correcting this as an outcome in the same way a person who needed apparent bypass surgery after 3 months of Jubbs cell rejuvenation required no surgery. Getting proper bowel flow assists foodstuff to move through the intestine naturally. Psyllium husk won't help that. Brain chemistry is directly dependent upon nutrient digested and assimilated and toxic metabolic byproduct being cleared properly. A synthetic antipsychotic and an antidepressant cannot regulate this action and is totally unnatural, yet applying Jubbs cell rejuvenation can. Jubbs probiotic life colloid has tyrosine, phenylalanine, tryptophan, GABA, carnitine, alpha-lipoic acid, glutathione, creatine, and many more nutrients, all supporting good brain nutrition. Synthetics as is Xanax, Klonopin, Ambien, OxyContin, Valium, and heroin withdrawal can cause brain cell death as shown by PET brain scans. Drug detoxification requires nutrient support for prevention of all benzo withdrawal. Jubbs cell rejuvenation programs balance brain nutrient, reduces excess histamine, and balances hormones. Healing metabolic neuropathy. Neurotransmitter imbalance test involves saliva, urine, and blood. Examine epinephrine, dopamine, GABA, glutamate, histamine, norepinephrine, PEA, serotonin. Metamatrix blood profile, full profile. Expelled air and stool analysis, parasites, mold, fungus, and yeast. SPECT brain scan examining RCBF. Full history of drug uses and effect and nutrition. A healthcare practitioner specializing in life food nutritional fasting and Jubbs cell rejuvenation interprets testing in conjunction with the client's doctors and balances by a treatment plan based upon the individual's clinical symptoms and unique neurotransmitter imbalance. Results serve as a guide for choosing appropriate natural course of healing. A specialist in metabolic neuropathy is one who understands neurochemistry and neurotransmitter dysfunction in relationship to celiac and mycotoxin infection and Jubbs cell rejuvenation, has training in natural methods of psychotropic phytonutrient healing to visualize brain function to heal RCBF, can consult and do follow-up testing, can customize treatment protocol based on a person's symptoms and lab test results, increasing neurotransmitter levels naturally. A neurotransmitter connects one nerve cell to another as a chemical messenger. Most familiar neurotransmitter include serotonin, norepinephrine, dopamine, acetylcholine, and GABA. Serotonin can be assisted by supplement of 5-hydroxytryptamine, 5-HT. Aromatic herb can have tryptophan and phenylalanine. Tryptophan converts into serotonin. Whole food vitamin B6 is necessary for serotonin production like tryptophan. Heat destroys B6. Excess such protein reduces B6. The author has applied neurotransmitter precursors including skullcap, passion flower, kava, ashwagandha, valerian, lady's slipper, theanine, hoodia, ginger, cinnamon, Gerania cambogia, blessed thistle, and humate. The author has a longevity formula that has ginkgo, gotu kola, foti, rosemary, ginseng, ashwagandha, skullcap, and periwinkle that assist with mental clarity, concentration, and alertness. Dopamine enhances libido and heals restless legs. The author has applied damiana, maca, horny goatweed, mucuna pruriens, muria puama, yohimbe, tongat, ali root, tribulus, mate, and humate. Much validation has occurred that this formula enhances libido, lubrication, tissue erectile dysfunction, and assists with orgasm. Jubbs probiotic live colloid increases and balances sex hormone in both men and women and is adaptogenic and brings overall balance to the brain and body. An enterochromaffin cell of the small intestine, as indicated above, produces serotonin. New toxin from non-life food reduce the formation of granules in the protoplasm of chromaffin cells of the small intestine that produce serotonin. The majority of these cells are found in the villi and crypts of the mucous membrane. Serotonin plays an important function in luminal information transduction via vagal afferent to the central nervous system that mediate pancreatic secretion. Non-life food is antagonistic and inhibits pancreatin and liver secretion, and causes synthesis inhibition of serotonin by enterochromaffin cells. Release of serotonin from enterochromaffin cells on Jubbs cell rejuvenation is triggered by life food luminal substance. This is a key to regulate gut motility and digestive organ secretion. For instance, nasal olfactory receptors trigger enterochromaffin cells. Life food nutrient stimulates odorant ligand. Spice and fragrance cause serotonin release. No sunlight, no vitamin D, no calcium, no mineral absorption, no depolarized potassium, no serotonin, no symbiotic intestinal flora, no serotonin. Jubbs cell rejuvenation increases neurotransmitter levels naturally. Otherwise, an enormous challenge can exist to physiology by way of synthetic serotonin. Not only can serotonin syndrome be present, but long-term hyperserotonemia serotoninemia effects can cause bone and cardiovascular challenge. Neuroendocrine cells, as is enterochromaffin cells, can be found in the majority of body organs. Enterochromaffin cells constitute the largest population of neuroendocrine cells. Serotonin release is vital to support CBF as well as blood flow and secretion of the gut. Synthetic serotonin and excessive serotonin release causes carcinoid heart condition and thickening of heart valves. Serotonin is a vasoactive substance and is important in systemic blood pressure regulation. Non-life food seriously challenges enterochromaffin cells and must be eliminated entirely to effect healing. A person can have an inborn error of serotonin synthesis and metabolism, and a non-life food diet only exacerbates symptoms. All strange indigestible protein from grain and bean must be eliminated, for this affects serotonin-modulated symptoms the most, such as bipolar disorder, depression, ADHD, and schizophrenia. Serotonin causes diarrhea. Serotonin depletion causes constipation. Methane excess in breath analysis shows low serotonin. Enterochromaffin cells regulate transit time due to evolution and its conditioned need of time digestion depending on whether fiber is present or not. Blended food features life food, nutritional fasting to assist the body to normalize enterochromaffin release of serotonin. High glycotic food and non-life food must be eliminated because somatostatin causes poor release of serotonin. Gastrointestinal carcinoid mimics greater gluten consumption and has increased some 74% in the last 3 decades. These lesions exhibit aggressive local invasion. High glycolic food, such as is non-life food, wreaks havoc on enterochromaffin cells and serotonin secretion, and also causes a fungal dysbiotic condition, and therefore, as indicated above, must at all costs be rid of to heal a metabolic neuropathy. A relationship exists of serotonin production and diminished virulence of fungal pathogen.